This topic is serotonin syndrome. Serotonin is a neurotransmitter that is associated with regulating mood, appetite, and sleep, as well as other physiological processes within the body. When serotonin levels are excessively high within the brain, this can lead to the development of serotonin syndrome, an emergent condition that is the result of excess serotonergic activity. Serotonin syndrome is not something that's going to occur naturally within the body. Rather, it is a result of taking certain medications, supplements, or recreational drugs. These include antidepressants, especially when these antidepressants are first started or if the client has an increase in the dose of that antidepressant. Any antidepressant that inhibits the removal of serotonin from the synaptic cleft can increase the risk for the development of serotonin syndrome. This includes selective serotonin reuptake inhibitors, or SSRIs. Again, we can see serotonin in the name of this antidepressant. Serotonin and norepinephrine reuptake inhibitors, or SNRIs, and monoamine oxidase inhibitors, or MAOIs. If a client is taking one of these antidepressants, it's important to know that there are many different drug interactions that can occur, which also increase the likelihood for developing serotonin syndrome. Examples of some of these supplements and drugs that can influence the reuptake of serotonin within the body include St. John's wort, tramadol, which is a commonly prescribed analgesic, and ondansetron, which is used to treat nausea. There are many other medications that can also influence the reuptake of serotonin. Lastly, certain recreational drugs can drastically increase serotonin levels within the body, and these include things like cocaine and amphetamines. Symptoms of serotonin syndrome have an onset of about 2 to 72 hours following ingestion of or use of the offending medication or drug. Manifestations are associated with an increase in excitability within the nervous system, and this includes all parts of the nervous system, including some of the involuntary and voluntary responses that we have. For instance, the client may have autonomic hyperactivity, which leads to an excitability of processes that we can't control within the body, otherwise known as our involuntary processes. And this includes a high fever, diarrhea, hypertension, tachycardia, and diaphoresis. Neuromuscular excitability can occur, which results in the development of tremors, clonus or involuntary muscle movements or twitching, hyperreflexia, and shivering. And the client's mental status may be altered due to the excitability of neurons within the brain. This can lead to agitation, restlessness, confusion, and hallucinations. Without prompt intervention, serotonin syndrome can lead to life-threatening complications, such as the development of cardiovascular shock, seizures, and death. This slide has an image and an animation that can help us better understand what clonus, or muscle twitching, looks like, and how to assess for it. The image on the left shows what happens when we move the foot briskly into a position of dorsiflexion. If the foot begins to twitch against this movement of dorsiflexion and pressure that we're applying to the base of the foot, this is an indication that clonus is present. We can see a demonstration of clonus in a pediatric client in the following video. The highest priority for treating serotonin syndrome is discontinuing any medications or drugs that may be contributing to increased serotonergic activity. In addition, we should question any PRN medications, such as tramadol or ondansetron, which contribute to decreased reuptake of serotonin within the body. Next, we want to administer benzodiazepines to decrease the excitability of the neurons. This can help to minimize or eliminate some of the client's symptoms. Benzodiazepine administration can help reduce agitation, as well as help to decrease blood pressure and heart rate, decrease muscle contractility, and overall can help with reducing the client's body temperature. With sustained muscle contraction and increased metabolism within the body, the client can be using up quite a bit of energy and oxygen to meet its needs. Therefore, we should make sure that we're monitoring our oxygen levels and try to keep them above 94%. Continuous cardiac monitoring will help us to identify any abnormal or life-threatening cardiac dysrhythmias. And IV fluid administration will help us to reduce the risk of rhabdomyolysis, which can occur from that increased muscle contractility. As I said earlier, muscle contraction can help contribute to that increase in the client's body temperature. Therefore, we should have ice packs and cooling blankets on hand in case that temperature begins to climb to a dangerously high level. And with an increased risk for developing seizures and febrile seizures, we should absolutely place the client on seizure precautions and monitor for the presence of any seizure activity.